everybody. We'd like to we'd like to thank you for joining us for our continuation of our COVID-19 safety series with our expert Reagan Branch. Today we will be talking about the film and theater industry. But before we do that, I just want to do some quick housekeeping. Everybody has been muted, and in order to be able to speak, you must be allowed to unmute, and one of us will ask you to, if need be. If you have any questions, please post them in the group chat. We'll be answering them in between our polling sessions. At this point, I'd like to introduce our Director of MBDA, Roxanne Nielsen. Roxanne, let me unmute you. Roxanne, are you able to unmute yourself? Roxanne, are you there? Okay. Well, on behalf of—
Hi, I'm sorry.
There we go.
Here we go. So nice to have the opportunity to welcome a small group to our MBDA. Our goal at the Minority Business Development Agency is to introduce new audiences to content that help them in the minority-owned business community. We know that theater is a 5,000-year-old art, and in some areas, theater is the essential tool for communicating, and we hope to see this industry come back. We were saddened by the news that the theaters will be dark here in New York for the next period of time until the pandemic has passed. But in the interim, we're providing this content both live and as a recording so that it can be shared with members of the theater and workers in the theater community. So with that, I'm so happy to be able to introduce Reagan Branch, who is our OSHA-trained professional who can introduce the content and the proper guidelines for working as safely as possible. So thanks to John Frias, who's our COVID director, Dr. Sheng Zhu, who is our center co-director, and I see a number of our team members here, Marlon and Ethan. So with that, Reagan, thank you so much.
Thank you, everyone. Thank you for joining us. And as part of my presentation, I will have Dr. Sadie Johnson talk about some of the testing protocols that have been found to be so necessary for these productions. And you have a free opportunity, you have an opportunity to ask questions about some of the things that you may be encountering as you work in your various settings. Either media, news production, television, or film. As you know, testing has been central both for New York State guidelines as well as for SAG protocols. All right, so I will be sharing my screen now. And feel free to ask me any questions as the slides progress, and I'll be sure to answer them to the best I'm aware. Again, my name is Reagan Branch. I'm a certified industrial hygienist and a certified safety professional. I used to work for the Occupational Safety and Health Administration in my past life, and I consult now for both construction industry, general industry, and do trainings, especially COVID. I'm also New York State certified to do infection control training. Okay, so What we're going to cover today is a bit of background about COVID-19, what brought us here as it relates to the disease itself, as well as the regulations for New York State. So the requirements for mandatory safety plan, which includes occupancy requirements, controlling of the hazards, also protocols and procedures for dealing with positive workers, solutions and strategies, some agency enforcement and liability information, as well as the references for some of the sources of materials that I cover here. In addition, John will send you a handout that I created, which includes the guideline for New York State, as well as the affirmation affidavit, as well as the SAG-AFTRA white paper guidelines for production during COVID-19. So we're going to start with polling question number 1. John, hit it.
So we're going to give about 30 seconds to answer the poll. I ask that everybody on the call answer the poll, please. Give a few more seconds. A few people will answer a little later. Three, two, one. Okay, here are the results.
Okay, so film industry plans for limiting the COVID includes all but. So the correct answer is B, on the offensive and plan for a shutdown. All of the above are prior to that are what is recommended by agency industry professionals, SAG, as well as public health officials. So they recommend hiring individuals to basically a new department that will be a part of your film production process. Someone, if it's a small crew, maybe an individual to do hygiene and cleaning, as well as ensuring that all the guidelines are being implemented. Isolating departments by creating a bubble. That's something that we've seen in other industries, such as sports, and that's what they're recommended in the film industry. So you create departments, and people work within those departments. So the crew, the actors are not going to be traveling back and forth between homes. Some studios have allowed for on-site boarding, and in the event that crew have to travel, they're traveling isolated. They're having private jets, private vehicles, and within those vehicles, they're still protected. And then they make the sets close and ensure that there is testing. That's actually the primary thing that they're doing to ensure that all the crew, all of the members of the operation remain COVID negative. So those three are actually the recommendations for ensuring that you have a safe production without a spread. Okay. Any questions?
No, not yet.
Okay.
What about TV shows that depend on studio audiences? Well, Rachel Smith has more on that. Hey, Rachel.
Hey there, Kev. It is going to be a lot more quiet on the set as Hollywood gets back to work.
I really really hope that we get to a point where we can come back together safely.
It's so crucial, the audience reaction to the dancing, that's something we would love to keep.
And we got 200 people in our audience. We'll never have that again. I want to go back to do our show.
From Wendy to Kelly and Ryan, everyone's expecting big changes.
Even if we have no audience, I can't wait to be in the same room with you.
A spokesperson for Live tells ET they'll be back from the studio without an in-studio audience on September 8th.
'Cause I give you all.
John Legend, one of the first to film a music video in LA, so did Snoop Dogg. And when it comes to what happens indoors on sets, an entertainment industry task force released guidelines recommending no packed makeup trailers and staggered meal times.
The buffet tables with, bagels and everything is not going to be something we're going to be seeing on sets anytime soon.
But what about those love scenes?
Love scenes on soaps are just the worst, right? So if they're going to cut those, I'm totally fine with it. There are no.
What about TV shows?
Okay, so we'll touch on all of those items, but basically, as part of like the entire world, film and television industry, were stopped. We came to a screeching halt in the earlier part of the year due to this COVID-19 virus. So what I have on screen is the Johns Hopkins tool that has been tracking the COVID-19 spread from the beginning of the situation in March. So I started doing training in early March, and I would visit the site every time I do a training. And back on March 17th, we had 182 million confirmed cases worldwide, and about 71 hundred deaths. On October 19th, about 7 months later, I did a bit of a search. I did the same search, Johns Hopkins, and the course of 7 months, 40 million people, over 40 million people have contracted this virus, and we've had over 1 million deaths worldwide. So the reason I bring this up is you can see what the spread was like over a very short period of time, and we know that we don't have those lockdown procedures that we had earlier in the year, and so there's an expectation to have a greater spike as we go as we approach the end of the year. And we've already seen like higher numbers than we've seen at the highest point, in the first phase, now occurring throughout the nation. So certainly the film industry will be affected by this. And we want to ensure that as you proceed, you are going to take the necessary protections to ensure that your staff and the production remain safe. So within New York State, just to bring it home a little bit, we're going to focus on this as well. We have, the first case nationwide was in January, and then on the 17th, New York State had its first case on March 1st, and then by the 7th, it was declared a state of emergency because we had, I believe, by that time, 76 cases within the course of a week. By the 10th, we had a containment zone in New Rochelle because of the 173 cases that we, grew in that space of time. 108 were in that particular area due to one individual being sick and spreading it to the entire community. By the 17th, New York City and Los Angeles closed movie theaters. And then we went into the pause within New York by the 20th of the month. By the 30th, most productions and studios stopped doing any kind of work that was throughout the country. And by April 13th, when this tracking system was done, this was done by University in Syracuse. By the time they stopped doing this tracking within the month, they had recorded almost 200,000 cases and 10,000 deaths, specifically within New York State. So this is just again bringing home the point of how quickly this can spread and how deadly it is. A bit more background, we had Executive Order 202, which declared the state of emergency for COVID-19. And then we had 202.1, which limited the ability to have large gatherings within large gatherings. So at one point it was limited to a maximum of 50 people. I'm sorry, 500 people. And then they cut that back later and said the maximum you can have is 25 in phase 3 and now 50 people in phase 4. So that's why theaters cannot open because of the 500 less, because of this cut and limit. So just a bit about how COVID-19 is spread. We know that it's from person to person. If you're doing any kind of interactions where there's contact within 6 feet, you're likely to get the virus by inhalation, right? The primary sources are from respiratory droplets that are transferred from an infected person when they cough or they sneeze. You also have airborne transmission over a long distance that might be possible. Especially if, it's something like sneezing and you have the right airflow that would allow the travel of the particulates or the droplets. You can also get transmission by touching surfaces or objects that are contaminated with the virus. So someone may have touched a surface that had bodily fluids, and you touch your nose, mouth, or eyes, and the virus gets transmitted to your body. Also, small droplet can also be transferred. There's a droplet nuclei theory where, the droplets that are produced as you speak, it becomes, becomes aerosolized, and the particles are, received by someone that is, within that location. So one of the things that are required as part of your plans for insurance safe activities is a communication plan. And part of the communication plan is an orientation for all personnel that are going to be working on your production or in your studio. But before you do that, you want to assess who is at risk, right? So OSHA came up with this pyramid where they have risks that range from low to very high. So of course, like medical workers are going to be the ones that are in the very high range, but depending on the type of work that you do, you may fall into the high, medium, or low range. So for movie productions, because of the variety of different staff you may have, the risk range from, actually, there's not one specific risk level that you experience, it's a range. So from low risk to high, right? And we're gonna talk about who falls into what risk level just based on, the type of work they do. So for instance, the low risk could be writers. They can be, individuals that are doing human resources, administrative activities. So there's not much interaction on a set, on the studio, on the production, right? So those people can work in isolation, they can work from home. Then there's medium risk. So these are jobs that require frequent close contact with people who may have been infected. And so for people that are coming to sets to, do deliveries, actors that may have traveled recently, crew members that may have traveled and don't know their status. And then jobs that are higher risk. So if you're working as a makeup artist, you're very close proximity to someone, for a very long period of time, you're sharing air. And so that would be a high risk individual if you're working with people whose COVID status is not known. All right, so kind of like went over a bit of this, but hazardous activities that put workers at risk are, cleaning. So some productions or some studios have residents for their staff. And so, individuals that are going to be cleaning those residencies after, the rooms after people have vacated or, have been sequestered because they're sick. People that are touching surfaces and equipment. So set designers, people that are handling microphones, because those are in close proximity to either performers or, singers, what have you. Hair, makeup, and wardrobe individuals, artists, they are also at risk. And then production activity. So, your PAs that are going between actors, that are going between a director, they're in very close proximity to a number of different people. And then for individuals that may have traveled, actors live throughout the country, they may work throughout the world, and so they travel. So that would put them at risk as well. And then as an actor, you're involved in intimate scenes. You're portraying a loving relationship as a parent or a spouse. So, affection and being close. So, definitely there is that risk there. And so just to get more, granular, production assistants, performers, sound and lighting personnel, set designers, directors, food service, maintenance staff, security screeners. These are all people that work within your industry that could be at a higher risk. Any questions, comments?
Reagan, just speak up a little louder. It's we're having trouble with the volume on our side.
Okay, I will do that. Any better?
I hear you.
Okay. All right, so we're continuing with the communication plan. So when you're creating this plan, you're gonna involve important stakeholders, right? You wanna ensure that, various departments are represented, because you have to think about all of their interactions and all of their needs during the production process, during the planning process, during the mobilization and ending, right? So everyone's input should be a part of this plan that you're creating. Once it's created, you want to make sure that there is orientation of all personnel, right? They get a chance to understand what are the criteria that you're going to be putting in place, whether there's screening, whether there is mandates that you are, not allowed to leave the set until the end of the production, whether there are zones as recommended by SAG, and how frequently are you going to be testing. So these are all part of the orientation of personnel. You're going to also discuss with them signage. So we're going to get into that. Updates and alerts via email, text message, telephone. You want to limit as much as possible communication in person, and also paper communication. So use of technology would be important. Who is the person that you would contact, as within the industry now, they're requesting that you have these teams that deal specifically with COVID. So who do you speak to if you need, your space cleaned or sanitized, or you need to, speak to the individual that does testing to get your results, and so on. So who are these contacts that are designated for the COVID activities? And then also tell them about New York State requirements, and I'll get into that as well as the SAG-AFTRA requirements. So the stakeholders that we talked about before would be performers, producers, studio theater, venue owners. If you're going to be scouting, the sites that you're going to be going to, those will be important too. Auditions as well, any support personnel, as well as production personnel. So the photo on the right was taken from Variety magazine. And, this is one setup that you would have, and this may be a small production where you have, this would be the COVID person that's responsible for sanitizing the set, or, having the products available or the PPE supply available. And this person would be in a designated area where, everyone would know how to get to him or get in contact with him. Right. So the orientation of staff, definitely go over COVID-19 bases and prevention. I know we're all probably very familiar with this and can write reports about it without even referencing material. But, just a reminder, especially about symptoms, you want to talk about that. And then also hazard communication program. Protocols, and basically how are you going to be reporting exposures or illness, and then daily screening. So before you come on site, maybe you want to have a survey completed with the questions about, past exposure and coming in contact with people that have been suspected or tested as positive. And of course, you want to let them know what temperature checks, where those are going to be. Are you going to have a queue to get on site in the morning? The distancing requirements. So are people going to be able to skip the line, that kind of thing. Also the chain of command. So who are you going to get in contact with, both with regards to COVID safety as well as the regular production, because we want to limit interactions as much as possible. So if you can say, well, instead of having someone walk around a set to get to the right person, you have a chain of command, you have a list of contact individuals available. Also, sick leave and work from home policies. So when are you gonna allow testing? It's gonna be something that's covered on the clock. How frequently? So is it gonna be once a week, twice a week? And then also the location that you're gonna go to, is it gonna be on set, or do they have to go to a location before coming on set? So controls as well. What kind of controls are you going to have in place? So some sets or productions or studios may have access control zones where only if you have a certain badge, you're allowed access into that area. And then also maybe cleaners would be the ones to have access to the full area and for cleaning purposes. And then PPE, what are the requirements for, PPE? So which staff are going to wear what kind of PPE, right? Because as you're doing, a performer is going to have to take off a mask if they're going to be having their hair done or makeup applied to them or something like that, right? Also physical controls that you may have. Also, making sure you have the right quantity of supplies on board, both PPE as well as cleaning products. How are you going to be doing the cleaning? And then also making sure you have EPA approved disinfectants and other products. How is the COVID safety coordinator? Who is the coordinator? Sorry, issue there. And how will the information be communicated, right? So are you going to do daily notices about, COVID and updates if someone was sick? Are you going to talk about who is going to be quarantined and for how long, or that kind of thing? And then also within that, you want to be careful of HIPAA protocols, making sure that you're not giving out or taking, identifying information such as, the person's actual body temperature. So instead of, collecting that data, you want to put whether they passed or they failed the screening tests, all right? Then also a physical site orientation or a walkthrough so that individuals can see what their zones are, where they're not allowed, and where restrooms are, things like that. Any questions? Okay, so as part of the communication plan, signage is important. So ensuring that you have the 6-foot markings and reminder posters, okay? And then also directional signs, you know, so that you limit workers or crew individuals on set coming in contact with each other. So, you know, forward and backward arrows would limit that kind of unnecessary bumping into each other. And then the demarcation of the access zone. So closed sets, things like that would be appropriate markings or signage. And then also occupancy limit, right? You want to, New York State mandates that occupancy be limited to 50% based on certificate of occupancy for the location that you're occupying. And then posting of your protocols. So whether it be the New York State protocols or your specific, set protocols, company protocols, above and beyond would be helpful. In this photograph, we have reminders that at the food station, that workers or crew members must sanitize their hands before they start to help themselves. And that brings us to polling question number 2.
I'll give 45 seconds for this one to be answered as well. And we have one question in the chat box we'll answer afterwards. Okay, these are the results.
Okay, absolutely. So depression and anxiety may come as a result of, this experience that we've been having, but it's not one of the symptoms of COVID, at least not yet. And that's a joke. All right, so there was a question.
Yes, the question is coming from Jeanette Posey. She wants to know, how do you suggest to disinfect equipment like camera equipment? That's a very good question, I think.
Okay, so of course those are electronics. One of the things that you can do, you can't put liquids on them. So disinfecting spray would not be ideal, or the use of, like steam or any of that stuff. What you might be able to do is use UVC light, like a UV lamp. So at the end of the day's shift, you can turn on and I have a lamp that I'll show you, that you can turn on the lamp and it basically cleans the room within there's a specific area of reach that you'll have with that light. So that's one way that you can do it. You can also clean like the the portions of it that can be cleaned with a disinfectant, right? So you can use a disinfecting wipe to maybe clean the handles and the parts that the operators would touch, and those are usually more durable. But for the more sensitive parts of it that cannot be affected by moisture, UVC light would be a good option. Okay, and so we're just a reminder, because I know we all know this, but just to remind ourselves, because we go through the motion. Okay, I'm gonna minimize, but can you see my screen? I want to stop sharing, but if you can see me, John, can you respond?
Say that again.
Can you see me? Can everyone see me?
I only see your presentation right now.
Okay. Gotta get out of screening, sharing. All right, so here I am. So this is a UVC lamp. It has the tubes, and this would give you, I think, about 10 feet of coverage. And so the minimum setting is 15 minutes. And so you would not have individuals in that space, and they would be allowed you turn on the lamp and it would do its cleaning. At the end of it, you're going to smell like like a burning smell, but it's been known to kill viruses and bacteria. It's used in a hospital setting in some instances. And with that, however, you want to ensure that whoever is operating it or will be in the room have proper eye protection, because it can cause temporary burning of the retina, cornea. Basically, it's a sandy, very painful temporary experience. It's like sunburns for the eye. So you want to ensure that you're protected. Okay, so just to bring it home, symptoms are coughing, high temperature especially, and that's why you want to ensure that you have the temperature checks daily, body aches, vomiting, and loss of taste or smell. And then there are some additional ones there. Okay, so we're continuing with the communication plan. So within New York State, and I'm sure in other states, they have mandated the reopening of certain industries, right? So in New York State, for instance, if you go on their the New York Forward website, where they had the phased reopening, you can check based on your NAICS code whether your industry was, currently how it can operate or if it cannot operate. So for theater companies and dinner theaters, New York State mandate is that they are currently closed. Okay, so they cannot operate at the moment. And we've heard recently about Broadway shutting down until 2021, unfortunately. Okay. And so when I did the search for the motion picture and video production industry, we found that it's allowed to operate, but with restrictions. And so some of those restrictions are covered in this document, which is an interim guidance for media production companies. So this guidance covers New York State's mandates. And if you don't have this, you're not allowed to operate. Okay, so basically you would have to go through this as a company, a production, a studio, and ensure that you're compliant with the mandated and the best practices, the mandates, but also they have best practices that are part of this plan. All right, so I'm not going to go through all of it, and this is going to be provided to you at the end of the this webinar, and you have a chance to go through it. So you read through it, and then you submit an acknowledgement online, as well as you have a hard copy available to you. The link to submit it online is available within the PDF. So, as I said, the plan, which covers people, so of course, physical distance is something that's covered there. Like I said, they mandate that you limit the occupancy to 50%. You have to ensure that gatherings in enclosed spaces are limited. But if you have to work in an enclosed area, you want to ensure that the mandated distancing is adhered to. You want to ensure there's proper flow of air in the spaces that you're going to be working in. So open windows, open doors if possible, or not gather indoors at all. We're going to see some examples of that later on. And then workplace activities are something like, so if you're a makeup artist, you know, and you're working, you know, next to each other, you want to ensure that there is 6 feet of distancing. And if there isn't the ability to do that, then you want to have physical barriers in place that would limit your spreading of droplets, okay? And this is, you'll see, this is similar to what you see in the restaurant industry, where they have like plexiglass barriers in place. So movement, they want you to limit movement. So people that are not essential to the set should not be on set. So no visitors, no family members should be allowed on sets, okay? Delivery, establish where delivery will be going to. And you know, when people come on set, where are they going to be going? So there's not this sitting and watching, you know, filming activities, right? People are only to be in the areas that they're designated. Protective equipment should be provided, and different types for different individuals. It should be worn throughout the production process, with the exception of when you're doing the actual filming. So, and temporarily when you're doing maybe a rehearsal of a scene, and certainly during makeup application and so on. But the individuals that are not the performer must be wearing their full PPE, and that includes eye protection as well as a mask for New York State. So the ideal would be to have a face shield and a mask available. So hygiene, cleaning and disinfecting, of course. So how frequently are you going to clean a workstation between use? And the availability and location of hand sanitizer and other cleaning and disinfecting products. So if you're going to be doing production, you want to have it phased as well. So you don't want to have all of the different departments on set at the same time. So if you can have the set designers there early and have them leave and then do filming at a later time, and that kind of thing, you want to work out in advance. And then also just making sure that you provide the training that's necessary to all of the parties that are going to be involved in the production. It doesn't have to be everyone at one time, but you can do training by department so that they know what their responsibilities are as it relates to the entire site, and how, you know, to prevent and protect themselves from exposure. And then the screening and testing process. This is the health component. Like, how frequently are you going to be screening and testing? Screening should be daily. Testing should be more than once a week. And then contact tracing and tracking. And what you're going to do after that. What protocols are you going to have in place so that you can return to work? You may have one individual that is positive, and if you're able to isolate that person quickly or figure out who they may have been in contact with, that would prevent you know, the shutdown of the entire production and basically the spread of it throughout the entire production or studio. So just a quick video. teleworking is a great way of you preventing non-essential personnel from coming on to set, into studio production, if they don't need to be there. You limit the amount of people that you have there, which affects your ability to operate anyway. You have to keep the capacity down, and also the potential for you to spread the virus among a greater population. So, what mandatory safety requirements, plan requirements. So once you've met with your stakeholders, you've discussed who are at risk, these are the things that you come up with. So you establish for staff and all the crew members and everyone involved who are at risk, and let them know what their risk level are. So the frontline individuals, security, reception, screening personnel, they're coming in contact with the greatest number of people, right? So anyone that's coming into the production on the set have to be screened and seen by these individuals first. And they're the ones who determine if you're positive, you have a high temperature, right? The janitorial and maintenance staff are at high risk as well, because they are the ones that are cleaning up eating utensils and dispose hand towels and tissue, used tissue and things like that. And they may be cleaning rooms that were occupied by individuals that were quarantined. So they're at a high risk. Food service are in the low to medium range, but they are also the ones that may potentially be a source of spread, okay, because they're working with food. Set designers have a medium risk depending on their access. So if they're able to just work in their department and put the sets out and not be interacting with the other stakeholders on site, then they are at a low risk. However, if they're moving between, they're at a medium risk. And then administrative and office personnel, of course, they're at a lower risk. People that are, producers that are not necessarily involved in the day-to-day activities. Writers can be included in that as well. HR individuals, they're at a lower risk. They can work remotely or not even to a limited amount on the set. And as I said before, those at risk of spreading are the people that have the highest contact, which are security, reception, the individuals doing the testing, temperature test screening, janitorial and maintenance staff. If you're sick and you're cleaning everywhere, you have the potential to be spreading the virus everywhere. And of course, food service individuals. And so if you look at the departments as well, the hairdressers and makeup artists, the wardrobe individuals, because they're within 6 feet of any performer that may be positive. Set designers can be at high risk if they're working, they are, doing changes, they're interacting with the performers, the directors, that kind of thing. Those are situations where they would be at high. Boom operators, sound and light personnel, if you're going up to someone to test the light, if you're going close to them to work on their mics, if it's a personal mic, you can be exposed. Actors, of course, are at high risk because they're working very closely with everyone. And then the production team, directors, and writers are low. Are there any questions?
None at this time.
So both in the New York State mandate as well as in other publications on safe production, they recommend following OSHA guidelines. So OSHA guidelines talk about hierarchy of controls. So ultimately what this is saying is if you can eliminate the hazard or substitute the hazardous material for something less hazardous, that would be the ideal thing to do. Of course, you can't do that with COVID, so we have to jump to engineering controls. And engineering controls are means of isolating people from the hazard. So those would include things like physical barriers, you know, putting up dividers between makeup stations. And we'll talk more about other activities. Administrative controls are things that are used to implemented to change the way people work. So limited how many people can be on set, the staggering the work shifts, the screening policies. These are all administrative controls. And then the final and, you know, the least effective, well, the least relied upon in the general occupational setting, but is personal protective equipment. You don't want to, you know, require an individual to protect themselves with equipment. When you're talking about a regular work setting in construction or you know, manufacturing, this would be the least acceptable or effective, right? However, with COVID, we know that wearing a mask is very effective in controlling the spread and also getting the infection, the virus into your body. So personal protective equipment is another means of control. All right, so I'm not gonna keep all that jargon up there, but so just an example of engineering control would be in negative pressure set, or so basically air is, clean air is, you know, downdrafted to the set. This would be in an enclosed building, actually positive pressure. Enclosed building, the air is collected and cleaned and then recycled, right? And then on this end, you have the physical barriers that you can move and relocate to different workstations and allow for that protection where you don't have the six feet distancing available. So this is just like, you know, a fun one. So if you're in you know, an area where you cannot distance, you can just for a break, you can sit in something like that to protect yourself from or isolate yourself from the other cast or crew members. And of course, you'll have air going in there. So other engineering controls you can do are install high efficiency filters in the ventilation system, increase the ventilation rate in the studio, office, or any high areas of congregation, install physical barriers, which I cover, sneeze guards, create a clear path through the office or the studio to increase navigation and minimize bottlenecking. So any areas where people would, you know, automatically come together or it's a tight squeeze, you want to eliminate that. So bathrooms, limit the capacity or implement single stall bathrooms and ensure that you have proper hand washing facilities available throughout the site. And also you utilize UVC lamps for daily disinfecting in addition to your cleaning. So some administrative controls that are already being implemented are ensuring that you have maybe your meetings on the outside so you can have the proper distancing. As in this case, implementing daily screening activities. Make sure that the cast and crew undergo regular testing. They stay in you know, pods or bubbles. So if you're able to have a house that you can you know, use for the crew or the performers while in production on location, that would be great. If you're in a studio, you know, have housing available for them, that would be great as well. Any non-essential individuals should not be there. So like family members should not be on set. and minimize contact between individuals. And stagger the shift, things like that are also very important and, you know, great ways of controlling interactions. So there are also some safe work practices that you can implement. This is an actual production where they went all out, where, you know, everyone is in polypropylene suits. And so the only exposures they have are their hair and maybe their neck and their foreheads. You know, these are examples of taking it to an extra level of precaution to ensure that you're not contaminating surfaces, you're not, you know, spreading between individuals. As you can see, they're working pretty close to each other, and so the distancing cannot be avoided. So additional safe work practices that you can have, making sure that you have the right amount of hand sanitizer available, making sure that you have hand washing facilities and signs reminding people to wash their hands, and also testing, you know, ensuring that you have a great testing program in place so that anyone that comes on set, that you know their status. Okay, and then personal protective equipment. So gloves are very important. We saw earlier that contacting with surfaces and our hands and touching our nose and our, you know, our eyes and our mouth, our mucous membrane are a way of us getting the virus into our bodies, as well as spreading it if we are sick and asymptomatic. So gloves should be provided in the quantities and sizes that are necessary for all the different types of individuals on the production or in the studio. So you want to train the individuals in how to don and doff, how to put on and take off gloves. So, you know, I've seen individuals wearing gloves and putting their hands in their mouth and with the glove on. That's not great practice. Or touching their you know, their skin with the glove, which should be contaminated. So just, you know, how to put on a glove safely, how to take it off safely should be parts of the training. How to prevent cross-contamination, and then also thinking about latex allergies. Some individuals may be may have a latex allergy, and that could send them into anaphylactic shock. So you want to assess your staff and determine if anyone there has that kind of an allergy. And again, adequate supply. So personal protective equipment involving face shield for New York, they require that you have both respiratory mask as well as eye protection. So this on the left is a scene from Tyler Perry production, where he requires all of the, you know, crew members to be wearing a face shield as well as a mask. One thing that I want to, you know, let everyone know is that the use of a mask with a beard is less effective, and they have a higher level of protection than, you know, a surgical mask or the traditional cloth mask. But still, in terms of receiving contamination, you know, having a beard would be a means for you to get particles in because of there's no close seal between the face and the mask. On the right, say you have an individual that has had a compromised immune system, maybe an actor that is pregnant, or an actor that's have an existing, you know, health condition. And so you want to, you know, protect that person. A makeup artist may be able to wear a capper, which is a air purifying respirator that encloses the face, but, you know, doesn't have that typical kind of appearance, right? So just a video of the capper.
In this capper training video, we will be discussing the system components and key features.
The MaxAir Camper system is a controlled air purifying respirator. It is designed to help protect healthcare workers from airborne particulates, aerosol, and droplet contaminants. The MaxAir hose-free technology allows...
And you get the idea. Basically, you're, putting that person in a piece of equipment that would prevent them from spreading to someone that they may be working with that's not wearing a mask. And that's, an extreme situation. However, we're at polling question number 3 now.
Once again, I'll give 30 seconds, and we do have one more question. They'll be addressed after the poll. Five more seconds. Thank you all. Here are the results.
Okay. All right. So masks do not filter out any microscopic organisms because they are not meant to do that. So masks are just for droplets, and those are very big particles compared to microscopic organisms. Respirators only protect the wearer from droplets and spray of bodily fluids. No, respirators actually protect you from very small particles. So the correct answer is the first one. It's designed to form a tight seal around your nose and your mouth. So it's a higher level of protection.
Thank you, Reagan. And the question that we have is, there was a slide that you had where someone was in a car and they were wearing a shield device. Mm-hmm. They wanted to know what kind of shield device that was. I think it looked like a bubble.
Yeah, it's some kind of a bubble. I forgot the link that I got it to, but but I will look for it. I've seen them before. People have used it originally for camping, where you would do changing or having a shower, but I think they've adapted it for the situation that we're in. So I'll look for the link and send it to you. Okay, so just to give you a little bit more insight into the difference between a mask and a respirator, N95 in particular. So surgical masks and N95 respirators are both disposable. So the design is one goes over your ear and the other one is a molded cup, and they have the attachments that go over your head. So the surgical masks are used by doctors traditionally, and they are approved by FDA. The respirator, the N95, it's like I said, a respirator. These are approved by NIOSH, right? So they have guidelines of what makes this a respirator. So basically, a respirator has material that acts as a filter, whereas a mask just protects from droplets being sprayed, and traditionally it would protect a patient from a doctor, right? Not necessarily the doctor being protected from the patient. When that is the situation, they would put the patient in isolation and have a greater level of protection, like a N95. So the face fit for a surgical mask is loose, right? So you can wear that with facial hair. You can see the sides can be open depending on the size of your face. They don't come in a variety of sizes, as opposed to N95, which are tight fitting. They're meant to be molded around your face. You can actually do a fit test, which is a way for you to determine if there's any leakage And then in terms of its filtration capabilities, surgical masks don't filter particles. However, an N95 gets its name from the fact that it provides at least 90% air filtration of particles of a large or small size. So up to 0.3 microns, actually. So the limitations for surgical masks, they're one-time use, maybe use it throughout your day and you dispose of it. N95 can be used several times throughout a week. I know in regular industry, you gift this to someone maybe 2 or 3 times a week, and they make sure that it's stored correctly and it doesn't get dirty and you handle it correctly. So also you want to ensure if you're going to be giving a higher level of protection to workers, they understand some of the limitations of them, as well as, risk factors. So if you have a compromised respiratory system, you have asthma or something like that, giving them something that's tight-fitting can further exacerbate whatever condition they may have. So with a N95, if it's not voluntary use, you require them to use it, you would have to implement a respiratory protection program. PPE, further, you want to, like I said before, think about the different departments you have and what kind of PPE you're going to need. So for hairdresser and artist, you want to make sure there's a mask. Maybe have them wear an N95 respirator or a capper, which was the one that we saw in the video, face shields and gloves. And then for wardrobe, maybe same thing. And then also for set designers, you would have the limited, just maybe the mask and the gloves. And then for actors, when they're not in the actual performance or, makeup or rehearsing, they would have the a range from all of the above to nothing. And then the production team, directors, and so on. So cleaning is important. You want to ensure that there is daily cleaning throughout the site. You want to ensure that the workstations are clean. If you're having, a makeup artist work on a number of different people, so between each person, that location should be wiped down thoroughly. So have the right types of materials. So you want to have cleaning cloth. You may have disinfectant spray. At the end of the day would also be something that you can do, and heavy cleaning between at the beginning of the day or the end of the day, so that you know that the next crew or the next team are going to be protected. And making sure you have the right registered disinfectants available for use. Okay, so some of the areas you want to think about cleaning are offices, at least once a day. Bathrooms and kitchens, you want to have that clean continuously throughout the day. Common areas, high touch areas, maybe 2 or 3 times a day. You want to look at door handles, light switches, elevator buttons, faucets, and things like that. Within the studio, at least once a day, and depending on what kind of activities and who are involved. And then for the production of the equipment, at least once daily. And between that, the staff should also be wearing gloves, so that if they're multiple people are operating one piece of equipment, they're not getting, they're limiting transmission. So part of having a safety plan, you want to have logs available as tracking, so that you cover yourself. So you want to have a log of the orientation that you've completed, your written program, records of your doing daily testing and screening. You want to have sign-in sheets for different departments, so you can do contact tracing. And then toolbox, maybe a safety, when in regular industry we say toolbox, but maybe a safety meeting once a week, and record that. And then also medical clearance. to return to work if someone was sick. And I will now introduce Dr. Sadie Johnson, who is on the webinar with us. She's a board certified emergency medical physician since 2009. She practices in an ER that has seen over 200,000 cases yearly. And she cares for many of the sickest patients in New York City, infected with COVID since March of 2020. So I'll turn it over to you.
Thanks, Reagan, for that introduction. Hello, everyone. As Reagan mentioned, my name is Sadie Johnson. I'm a board-certified emergency medicine physician, currently practicing in New York City. In the next few slides, we will talk about the mandatory daily safety protocols, which should include a screening questionnaire, a daily screening questionnaire before each person arrives to set, temperature checks before entering the site, and testing, whether it be daily testing or 3 to 4 times a week, depending on the rotation of actors and crew to the set. And finally, contact tracing. Each location should have a designated person or team that would be responsible for contact tracing. We will also discuss how you will quarantine if you're tested positive, and exactly how you would return to set after your recovery.
So Sadie, I didn't put those on slides. So I just wanted to have like a free conversation. So
Sure.
Just go into, each of those topics and talk about them and what you recommend.
Sure, absolutely.
I'm going to stop sharing the screen so they can see you.
No problem.
Okay.
So as far as the daily screening questionnaire goes, you can either create an app or a survey monkey that each person will fill out daily before arriving to the location. And this questionnaire would include questions regarding current symptoms and recent travel history. When they arrive on set, they would show the results to the monitors who are doing the temperature checks for each person. And if all of your answers are no, then you're cleared to work that day. If there's a yes, then you need to determine which question they answered yes to and whether that person needs further testing. So as far as testing goes, the FDA has currently approved 2 types of tests. The first is a diagnostic test, which would indicate if someone has active coronavirus disease. And the other is an antibody test that says whether a person has had exposure within the last 3 months. As far as the diagnostic test goes, there are 2 types of diagnostic tests that have been approved by the FDA. And the first is a point of care test or an antigen test, which identifies proteins that are on the surface of the virus. And this is a very rapid test. You can get results back in less than an hour. The other test, which is a molecular test or sort of a DNA test of that virus, is basically done in a lab, and it's a PCR test. Both of these tests are done either by nasal swab or by a swab of the throat. There are also saliva tests, and regardless of how you get the sample, it's important to know how sensitive your test would be. The PCR test it can be done in a lab as well, and you can get results back in less than an hour. We've come a long way since March, and so instead of waiting for 3 to 4 days for results, you can actually get results in less than an hour. The other test, which is the antibody test, is done in a lab, and basically it's a blood test. This is a test that identifies whether a person has made antibodies to the virus. This is your immune system that produces antibodies to help you fight off the virus. And this too can give you results back. You can get the results back within a day now. I know in the past you had to wait for days, but now the results can be available within a day. This is a test that shouldn't be used to determine if someone has active coronavirus infection. Finally, Reagan, should we move on to contact tracing?
Yeah, go ahead.
Absolutely. So currently in New York State, we have a very robust contact tracing program that helps to keep our community safe. We're basically identifying those persons who've come in contact with anyone who has tested positive. And this allows other people, anyone who's been in contact with someone who's tested positive to basically monitor themselves for symptoms. In addition, it allows for asymptomatic people to get tested, and basically helps us to navigate how to quarantine. So on each location, there should be someone who's designated to keep a record of who comes on the location each day, their role, and basically who they're coming in contact with. If someone tests positive, you want to make sure that you know who that person has come in contact with, so that everyone that they've been in contact with can quarantine, and you don't have to shut down your entire set because one person has tested positive. And when I say that someone who's come in contact with a person who's positive, it's anyone that's been within 6 feet distance of a positive person for more than 15 minutes, a total of 15 minutes. So even if you were in contact with that person for 5 minutes, you left and you came back for another 5 minutes, if the total time that you've been in contact within 6 feet of that person is more than 15 minutes, then you should definitely quarantine. Right now, New York State is also asking anyone who comes from out of state or any endemic area to quarantine for 14 days. Right now, we have about 40 states on the list, the travel guidance list for New York State. So any actors who are traveling from out of state first must quarantine for 14 days before they can even begin to start working. In addition to that, if someone tests positive, if they have no symptoms, then they can quarantine at home. And it would be very important to have a contact tracer that would help them navigate how to do so. How do they get food? If they need medication, how do they get all of that? Yeah.
And
so that's basically how the contact tracing would work.
Is there, I know there's a form you have to fill out and penalty from your state for travel.
Yes, absolutely. So New York State has a travel health form that you must fill out once you enter the state, whether you enter by air or by car. Anyone who comes through the airport must fill out the form before leaving the airport. And anyone who, travels here by car or bus can fill out the form online. There's a $2,000 penalty for anyone who fails to do so. And if you fail to respond to the calls from the contact tracers, there are also hefty fines for anyone who doesn't respond. So New York State is taking this very seriously, so please comply.
And if you were determined to be positive, like what are the protocols for returning? Like after you quarantine for like the 14 days and so on. Is there a clearance test?
Absolutely. So you want to make sure that that person has a negative PCR test before returning to set. If you do an antibody test, they may have developed antibodies to the virus. And so that test may be positive, but they can definitely return to set, but they must not have symptoms. So no fever. You may have a lingering cough, but it shouldn't be, your symptoms shouldn't be as severe as they were when you had active infection.
And so is 14 days the minimum, or like if you are sick, like you should be longer, right?
Absolutely. If you're continuing to have symptoms, for example, shortness of breath, fever, muscle aches, then definitely that time can be extended, but 14 days is the minimum amount of time of active infection.
And I think one more question. For the people that are have a antibody test, does that mean they are protected from getting the virus again? Is that like?
Absolutely not. So if you've developed
your PPE and all that stuff.
Say that again.
So that they can say and justify, well, I don't have to wear PPE because I'm like, I had.
Absolutely not. You still have to wear your PPE. So even though you may have developed antibodies to the virus, this does not provide immunity. And we don't know how long it will be before those antibodies wane or disappear from your blood. So you definitely have to still wear your PPE once you return to set. And I think we don't know enough about this virus yet for us to be complacent and, not wear our PPE once we're on set.
Awesome.
Mm-hmm.
Are there any questions for Dr. Johnson?
No, there aren't any questions in the chat.
Okay.
Okay, perfect.
I will have her information available if you wanted to reach out, or actually reach out to her directly, or you can reach out to Bach or Roxanne or John or any of those individuals, and they can put you in contact with her as you design your testing protocols for your production or studio, or or whatever it is. I'm gonna go, and she'll be on the call, so if you have any questions, you think of anything later on, you can ask her. So just to go back, we have a polling question.
This one has 2 questions, so I will give double the time. I will give 1 minute to answer both of the questions, 1 minute. And once again, feel free to put any questions in the chat. I see one coming in right now. Thank you. And we will answer them as soon as the poll is over. Thank you. Okay, ending the polling now. Sharing the results.
So yes, Dr. Johnson stated a diagnostic test is a test for the active virus, and if you're positive, you should quarantine yourself and isolate yourself from others. And the antibody test, it looks for the antibodies that are made by your immune system after you've had the virus. Is there anything you'd like to add, Dr. Johnson?
So absolutely. So that's great. Everybody got number one correct. So basically, as I mentioned, the diagnostic tests are either, a molecular test or a PCR test. And those are the tests that will identify the virus. They identify whether someone has active infection. And these are the tests that you will do on site, or you would do before someone comes to the set. And you get results back, within an hour or two. Whereas the antibody test is a blood. Oh, sorry, just to go back, the diagnostic tests are basically swabs. They're either swabs of your nasal passages or your throat, whereas the antibody test is a blood test that identifies if you have developed antibodies to the virus. Yeah.
Okay, thank you. And we have a video, but it covers all that you said, so I'll move on.
As part of its effort to
and now we'll go to polling question number 5.
This one will go for 30, 35 seconds. And as soon as this poll is over, I will address the question in the chat.
Mm-hmm. I think everyone's answered.
Here are the results.
Awesome. Yes. So all of the above. Dr. Johnson.
Absolutely. Yes. So that's correct. All of the above answers are correct. Contact tracing basically just helps us to protect those in our community. It allows us to identify those people who come in contact with somebody who's positive. It allows you to monitor yourself for symptoms. It allows us to test also to determine, those people who are asymptomatic. And so when we test, we can actually identify those people who are asymptomatic but are positive. And finally, it allows us to quarantine or isolate those people so that we can prevent further spread of the virus.
Great.
Okay.
Thank you, Dr. Johnson. The question that we have in the chat is, what are the innovative practices that students at theater, in the theater city colleges are using, if any?
I personally don't know. I know I'm going to cover with regards to performance some of the PPE designs that they've had. I know there's a mask that's designed for singers, as well as for musical instruments that are the air instruments, the ones that you're blowing into. There are covers that you can put on the instruments to prevent the spread of sputum and so on. But I haven't actually researched, what they're doing in the schools. So that's my answer. We'll look into it. Okay, so we're moving forward. Solutions and strategies. So an engineering control that you can have is to use the MERV 13 filter. MERV stands for minimum efficiency reporting. Again, a filter is a means for you to collect an air that is contaminated, and then allow the dispensing of cleaner air. Okay, and so the number 13 actually refers to the rating and how efficient it is, and that also correlates to cost. Okay, so the higher the rating, the 13 and above refers to like a HEPA quality, which is high efficiency particulate, and so that's basically what's been recommended for a lot of indoor spaces, including gymnasiums and restaurants and so on, if you have a central air system, a system that would use the same air and filter it throughout a building. Of course, if you don't have that, that's not a requirement, but you can also use portable air filter devices in your offices or your whatever indoor enclosed spaces you may have. And the MERV 13 filters particles between 0.3 and 1 micron. And just to give you a little bit more information about the MERV 13 range, they're used in hospitals, inpatient care areas. It's used in smoking lounges and in commercial buildings that are considered superior. And it's good for particles as small as bacteria and tobacco smoke, as well as the particles that are produced during a sneeze. Okay, so this is just a little bit of a talk about the MERV 13.
I'm glad that you brought that up, because the ventilation is an ongoing conversation in both the medical and public health communities. I mean, I've spoken to numerous sources about the importance of increased ventilation in indoor spaces and where people gather. Can you discuss this MERV 13 filter?
Sure. So I refer to as MERV, right? My friend MERV 13. The reality is that the rating scale, really starts at MERV 1 and can go all the way up to MERV 20. But you've probably heard the terms HEPA and OLPA, and those are the higher ends of that MERV rating. In the United States, the CDC came out in early July and recommended that any commercial or office building put MERV 13 filters in place. What that really means is the micron level. So it sounds a little geeky, and I apologize, but at the end of the day, what a MERV 13 filter allows you to do is to filter to 0.3 microns. To put that in terms I can understand, it's 1/100th the size of one of our human hairs. So it's at the 0.3 micron level that a MERV 13 can filter particles out of the air. In our homes, you traditionally would have a MERV 8 type rating. So when you think about everybody upgrading to MERV 13 or higher, what we're doing is putting filters into our already existing HVAC systems that improve the filtration within our indoor spaces that are able to trap particles, including viruses and bacteria, making our indoor air space that much healthier. And it's really a combination of that and wearing masks that gives us the confidence that we can survive, live our lives relatively normally amidst this pandemic until and unless a cure is found.
I'm glad that you...
All right, so this brings us to poll question number 6. John, take it away.
Okay, poll question number 6 coming up now. This is another two-parter. We'll take 1 minute. And once again, I encourage you to put any questions you have in the chat. Okay. 20 more seconds. It looks like everybody has answered. And the polling, share.
Okay, great. So disinfecting, everyone got that right. It's a process of killing microscopic organisms on surfaces. So you can spray Lysol or Microban, which is recently approved, on a desk or table or whatever, and that will kill the organism, virus or bacteria. On the other hand, you will need cleaning to remove the dirt and the visible dirt that's on the surface, right? So you'll use a wipe or a sponge or cleaning in a bucket or cleaning with a mop, water to remove buildup dirt. You can disinfect in the process of cleaning because you're physically removing the virus or bacteria, right? But disinfecting is just the process of just killing without cleaning. All right, so as we get into cleaning now and agency enforcement and liability, the CDC has set up, guidelines of how to clean and disinfect. The New York State guidance also has recommendations of how to clean and disinfect. But basically, you want to develop a plan. As with everything, you think about all the different surfaces throughout your production, throughout your studio, office spaces that are going to be touched, the potential for having the hazardous virus on it, and then the risks to the workers. Then you want to implement the plan. So you're going to, train your maintenance staff or your janitorial staff to clean that surface on an ongoing basis, right? Maybe the door handles and light switches or heavily touched areas on multiple times a day. Certainly the bathroom as well, the food areas, throughout continuous cleaning. And then you also, after you've implemented the plan, make sure that it's maintained and if necessary, revised. So in the process of maintaining it, making sure there's adequate supplies, that it's done consistently. I know, for my residential building, during the high COVID times, you smell bleach everywhere. But now it's not as enforced as much, right? So after a time, people may become lax and complacent, but you want to ensure that there's maintenance, continuation of that routine. And then also revise it if you're feeling that, well, these areas aren't being addressed, or a new piece of equipment or a new department's been created, new staff or whatever, you want to revise it to include that area. And then any products that you use that you want to say are using as disinfectant to kill the coronavirus, you want to check it against the EPA list. And basically, you can go to the EPA.gov, or you can go to CDC and it can direct you to it. And this particular site, you can search by the name of the common name, the ingredients, or the contact time. And that's also important when you're cleaning, to make sure you have the proper contact time, because applying cleaning product or disinfectant you may need to have it on that surface for an extended time, between 1 minute and maybe 10 minutes to clean it, okay? And if you don't have the adequate supply, it's possible that we may run out if things shut down, just like you did earlier in the year. You can create a cleaning solution with bleach, and that is also available on the CDC website. it's important that you know that you cannot leave it in the, it's only good for one day. So it won't be as effective in the next day if you just, you know, created it the day before. So that's something you want to create on an ongoing basis. And you want to ensure that you have the right contact time for it. Not every surface you can use, you know, these products on. You want to ensure that for, as the person asked the question before, you have the right kind of cleaner for the right surfaces. So certainly on wardrobe, you're not going to be able to, you know, apply cleaning products. You're not going to be able to wash those. So maybe steaming can be used, or if that's not possible, the UV lighting may be possible as a means of cleaning. And certainly on porous surfaces, you don't the virus has been shown to not be, not last for more than a day. So, you know, cleaning may not even be necessary if you space out the use of that particular garment, if it's a soft surface. Right, so as I mentioned earlier, SAG, which is the Screen Actors Guild, they, I believe, are a union or for performers. And so they have created certain guidelines that can be used for different types of affected individuals. So for performers, they recommend that they refrain from handshaking and hugging, carrying their, make sure they carry their own pens, or even, you know, making sure that any signing or writing that you have to do is done electronically. Make sure their hands are washed on a regular basis. Bring your own makeup and brushes or sponges. Bring wipes for your trailer and your workspace to clean door handles or frequently touched surfaces. Opt for digital call sheets, production reports, and contracts when possible. If asked to participate in large crowd screenings, refrain from lingering in the crowd or holding areas unnecessarily. So get in, get out. You know, in terms of performers, you know, there are multiple challenges. So definitely testing will be you know, the main part of any plan that you create, so that you ensure that these individuals are negative of COVID and that they remain that way. So limit also their interaction with people outside of the other actors or folks on set. So this is from Saturday Night Live, which I thought was funny, of how they envision the acting industry to be. So, you know, there's a glass between the performers as they, you know, do intimate scenes. So for broadcasters and voiceover artists, they recommend also, you know, taking care of sanitation, making sure that the common areas in the broadcast facilities are cleaned and sanitized regularly. And it should be cleaned and sanitized between shifts, before and after each shifts. Use disposable covers to protect microphones and booms to avoid any touching. Certainly wearing gloves. Conduct interviews by phone or on video, which I've seen a lot with my local newscasting. Have a studio at your home. I've seen the weather guy, you know, in his home, you know, doing the weather reports. And if you're assigned to a press conference, you know, try to maintain social distancing or monitor the conference remotely. And then assignments to hotspots, meaning like areas where there are outbreaks or high incidence rates, you know, making sure that you have a hazmat suit, respirator, and proper training are what they recommend. So we've seen this, you know, inventive use of, you know, various handles for the mics, retracting equipment. Also, individuals working from home to do, you know, television work. So for singers and artists, again, making sure that you have your PPE. During breaks, you want to make sure that you wash your hands. You can do recordings remotely, which is something that, probably was unheard of before. I've seen entire choirs, create musical productions that way. Of course, disposable covers for mics and avoid touching. Ask the engineers or staff if you can use your own headphones. Make sure you fine tune your home studio and let your clients know that you're prepared to sing remotely or send files back and forth. And if you're at concerts, whenever that happens, don't allow fans to touch the merchandise. And you don't wear stage clothes unless they've been washed and disinfected. So I mentioned the singer's mask. This is this one. Basically, it's a flexible material around the mouth. So that would allow you to open your mouth widely. And it has the same close seal towards the face. This is for an individual playing a trumpet. As you can see, the mouthpiece is in the mask so that any sputum that's coming out from the side is captured in the mask, and certainly the covering on the end of the instrument so that you don't have any particles coming out. And so you can do recordings remotely. And certainly if you're gonna do live performance, you can isolate performers, or you ensure that they have social, you have distancing, or you can have these performance outdoors, which would be even, greater effectiveness. For auditions and castings, they want to ensure that props are wiped down before and after use. Maybe have pre-packed food instead of having the buffets and that they usually would have. Limit interaction as much as possible. And then limit groups to a maximum of 10 in a room. And so for performers, dancers, make sure that they, the set pieces that are being that they are interacting with are cleaned and sanitized between uses. And then for minors, only the parent in the audition room to help manage the child. Allow the parent to manage the child. So again, they are not touching any surfaces, they're not allowed to, and so on. So, photos of individuals doing auditions remotely, interviews remotely, and certainly there are shows that are doing remote work, such as America Got Talent, who are holding their auditions, who've held their auditions remotely. And we have poll question number 7.
This is the last question.
Okay.
Correct, Regan?
Yes.
We will give 35 seconds to answer this question. And we have one question in the chat that I think you might have actually answered.
Okay.
But we'll address it after the poll.
Okay.
Here are the results.
Okay, great. So the correct answers are that it's not optional. So you have to comply. I'm sorry. I'm sorry, the correct answers are 3 of them. So I kind of like, I think I didn't do that as well as I should, the question. So I'll go through them. So employees, cast, and crew are allowed makeup of a live audience of greater than 100 individuals or 50% of the audience, whichever is lower. So you've seen, TV shows, this is the requirement. Under physical distancing requirement, total crew size may not exceed 50%. Okay, so it's 50% of the capacity for that space that you're in. So I made that question a little too hard. And then the owner, manager, or of the media production company is responsible for meeting these standards, and it is a requirement that you follow it, and it's not optional. So there are best practices, but then there are requirements as part of the plan as well. So.
All right, the question in the chat is, what are best practices for intimate scenes?
For intimate scenes, making sure that everyone that is on set has been tested and remain quarantined. Not quarantined, but in a bubble, right? So before arriving on the set, individuals are tested. They are, if they've traveled, quarantined for 14 days, and you do daily testing to ensure that they remain that way. Actually, the next slide that we go to talks about the Tyler Perry studio and what they've been doing, because they were I think one of the first productions to have opened that was actually completed without having a spread event. So I'll show the video, and this will be the last.
Media mogul Tyler Perry made headlines recently when he announced that his studio would resume production. He's got a 30-page plan for keeping the cast and crew safe from the coronavirus. Now, it is among the first studios in the country to reopen after the entire industry came to a halt amid this pandemic. So first on CBS This Morning, he let us go behind the scenes to take a look at the sprawling is the word, Tyler Perry Studios in Atlanta, to see how safety is being made a priority on his set.
Delta and Echo, Mark.
Tyler Perry has very ambitious plans to film the new seasons on his 4 TV shows, all while keeping the 360 people on his production team safe from coronavirus. He's calling it Camp Quarantine.
Let's go get this. All right.
All cast and crew are required to live on site for each 2-week production. And to limit exposure, Perry is flying in actors from LA and New York on private flights. Wearing a mask and social distancing are strictly enforced.
Everybody social distancing, hand sanitizing, 6 feet.
And medical staff test everyone every 3 to 4 days. The media mogul even constructed new buildings on his Atlanta lot to provide housing on site, with perks like food trucks and movie nights to keep spirits high. All the work and planning paid off.
This is our second round of testing, no positives.
Perry wrapped his production ahead of schedule, with cast and crew walking off his lot testing negative for COVID-19. And he plans on doing it all over again when the next production team arrives at Camp Quarantine. Tyler Perry joins us now from...
Okay, so there is more to that, and this will be available if you want to, the entire PowerPoint will be available for you to view, and you can see the rest of it in your, on your own time. But basically, even with, there has been for his studio, there was a driver that was positive that had been driving around actors and crew members, and even with that person being positive, the crew did not have, or the actors did not become positive as well, because they were required to wear masks, as well as have the windows of the vehicle open. So you can see, if you're following the protocols in full, you can prevent, exposure, even if you have a positive person on your production.
Media mogul.
All right, so are there any questions? If there are, please feel free to ask them, and my contact information is here, as well as the contact information for Dr. Johnson. And I also have in the end of the presentation all of the resources that I went through to put this together, and certainly you can view it on your own. Questions?
Looking at the chat, there are no remaining questions. I'd like to thank everybody for attending today. We will be following up from MBDA with collateral from today's meeting. And if you missed anything, we will do our best to send you a recording of today's meeting. Thank you, Liz and Roxanne, for the words, the positive words. Thank you so much. If there's nothing left, I'm going to pass it on to our director, Roxanne, to close us out. Roxanne, could you unmute yourself and join us? Give us some closing words.
Yes, hi. You know, I think that this information, you know, unfortunately, we didn't get a lot of the community here, but I believe that we have a couple of people in the industry here. If we could help spread the word, we are happy to, you know, run this for communities of, you know, crews and in the theater film among minorities in production. We're happy to arrange a special training. Reagan is great. She's done a lot of training all over the community in various industries, and we're so very happy and proud that she could lead us today. And we're really interested in the work that Dr. Johnson has done to share with us today. We really appreciate her work as well. So thank you so much, Reagan, for putting it on today.
Yeah, absolutely, you're welcome.
Thank you, Reagan. Thank you, Dr. Johnson. And thank you, MBDA team. And thank you to all our participants for joining us today.